before and after. This I think I was clear yesterday. Where I was not clear is about this kappa statistic. This is especially for the PGs from pathology, microbiology and all. Kappa statistic. See, McNamara, I will tell you example. When to use McNamara, when to use kappa statistic. Categorical test, you are assessing whether outcome is hypertension present or absent. That is your outcome. Predictor variable is paired means before and after. Before and after your drug. So in that case, before and after, hypertension present or absent will be McNamara's test. When it is, you are just calculating raw BP before and after, then you will use parity test. But hypertension present and absent, you have the data, and before and after you use McNamara's test. For kappa statistics, same patient, it is for the inter-rater reliability. When you have a pathological diagnosis and clinical diagnosis will be there for the same patient. So then in that case, you need agreement between a pathologist and a surgeon. So or a microbiologist and a clinician. So in those situations, for the same patient, you diagnose it as typhoid. Clinically, the clinician diagnosed it as typhoid, and for the same patient, that is a paired sample. There you should use a kappa statistic. Then I told about chi-square test and Fisher's exact test, logistic regression, sensitivity and specificity. Your outcome variable is categorical, diabetes present or not. Your exposure variable is, suppose your blood sugar. You are deciding blood sugar. Predictor variable is blood sugar. Outcome variable is some diabetic food or something. Then you should use ROC curve. Okay, that is the test of choice. Again, sensitivity and specificity also used after categorization. So this is the ultimate glimpse of this session. This one slide carries 90% weightage of my session. So now we will move on to the exercise. As I told first now, Kanana will tell the answer for the next question. So the comparison between two groups, categorical data, non-parametric data. So here is one example between smoking and lung cancer. So you didn't see that. So smoking and lung cancer. So we have lung cancer. So in any 2x2 table, the basic is the disease should be on the top, plus and minus, and the exposure factor should be on the left. That is on the column. This is on the top, on the left side, exposure. So smoker present and plus should be on the first. Present should be on the first. So in this case, what is the test of choice? A category compared with the category. The answer is chi-square test. Okay. So now we are comparing between two groups. Association between age and TB. So TB present and absent. Age we have categorized. Again the same. There is no twist here. It is chi-square test. Now the epi-info group. Comparison between two groups, categorical data, association between smoking and lung cancer. We have got a data like this. Smoking, present or this thing. So what is the test of choice? Epi-info. Okay, the answer is correct. Answer is correct. If you say chi-square test, it is wrong because the expected value here in SPSS it will give this expected value. So in this is the only twist here. So in any 2x2 table, no, I put up chi-square test is wrong for this. Wait for the answer. Okay. Till I put this, he will not rest himself. Okay. This is exact. This is the correct answer. Gulam, chi-square is wrong. Why chi-square is wrong is I am explaining here. One cell is having an expected value less than 5. This 1 is the observed value, this 3.4 is the expected value. Expected value, don't worry what it is, it will automatically, when you do chi-square test in SPSS, it will give you are getting an expected value less than 5, so you are not supposed, it will give us asterisk mark and it will explain why that asterisk mark is there. Don't worry, but you should know and under what circumstances you should use between hypertensive and normals. So the hypertensive score was, anxiety score among hypertensive was 5.91 with a standard deviation of 0.65. Normals, mean was 3.9 and standard deviation of 0.51. Assuming the data are normally distributed, since the variation is less than 50% of the mean, rule of thumb, this is the rule of thumb, not scientifically incorrect. So what is the test of choice? I have displayed. You are going to, your exposure variable is a categorical variable, outcome variable is a continuous variable. So what is the test of choice? I think people have seen it and they are acting as if they have not seen it. Yeah, tell me the answer now. Yeah, it is independent t-test or unpaired t-test or two sample t-test. Okay, so this is the choice. Now the question is for the group 4, and we use z-test for the larger sample size. What is z-test? If the sample is more than 30, we can use large sample size, but more than 30 also t-test is good. Okay, for any sample size t-test is good, but z-test you can use only for large sample size. So when you get output independent t-test, here I have said simply the normality test for normality. This independent t-test alone assumes one more assumption. Okay, that is the equal variance assumption. So how this data are varying. So you have to check between the variances of those two groups, and if it is significantly variable, you cannot use independent t-test. Okay. So now, as I said, in chi-square test, you will get an output for Fisher's exact test. See, one of your cell value or this many percentage of cell values are less than 5, so you cannot use chi-square test. Like that, for independent test also, SPSS give output like this. It gives the Levens test for equality of variances. When the equality of variances is not there, then you cannot use this independent t-test. And this assumption, so independent t-test have now two assumptions. One is normal distribution assumption, and the other one is this Levens test assumption. But the Levens test assumption is more important than your normal distribution. That is, I think I am confusing. Okay, there are two assumptions for independent t-test. One is your normal distribution. Normally it should be normally distributed. Then the second assumption is this Levens test equality of variance should not be significant. Out of these two, Levens test is more important than normal distribution. Okay. So independent t-test. So any test will calculate a test statistic like this. Test statistic like this. This is a test statistic, and it will give a significance two-tailed like this. So this is your ultimate p-value. So guys, every test, don't worry about what is the test statistic, everything and that. After doing the test, simply go into the p-value. That's all. So here p-value is, this one is the p-value. Like that everywhere significance two-tailed will be there. Okay, clear? Okay. Now comparison between two groups, which group it is? Okay, comparison between the two groups, non-parametric test, that is, we are comparing the mean anxiety score between hypertension and normal. Exactly, not exactly, almost similar to the previous question. Hypertension, among hypertensive, the mean value is 5.91, standard deviation is 3.65. Among normals, the mean is 3.90 and standard is 3.51. Now what is the test of choice? Okay, we will go to the answer. you say independent t-test, here it is wrong, because the data is skewed from this mean and standard deviation. You have to represent it in median and interquartile range. Okay, since it is a skewed data, you have to use Mann-Whitney U-test. Mann-Whitney U-test is the correct answer. Comparison between more than two groups. I think comparison of mean anxiety score between hypertensives, pre-hypertensives and normals. So hypertensive mean is 5.91, standard deviation is 0.65, pre-hypertensive 3.90, 0.51, normal is 3.3, 0.61. What is it? The answer is ANOVA, F test. It is otherwise called as F test, which is a parametric test. Here, if it is not normally distributed, you should use Kruskal-Wallis test. These are all just names of the test. Statistical software will tell, statistical software, if you know how to do it, how to click that button, then automatically p-value will come. You need not bother about anything beyond it. Now, we have post hoc, the concept of post hoc in ANOVA. Suppose the ANOVA test result says significant p-value of 0.0023. All the three groups does not have same anxiety score. Okay, so in the previous thing, we have seen there is a 5.91, 3.90, 3.30. There is a difference, but you want to know individually among between those groups which contributes the most, which is more significantly different from other. Now first is, when we are comparing two continuous variables, we use a test called correlation test. Okay, that is your BP and hypertension, BP and age. If you want to compare between BP and age, then you should use correlation. Now I think yesterday Partha sir was telling, do a correlation study. Why do a correlation study is wrong is because correlation is a statistical test which we use. Unless we use a correlation test, you cannot say correlation study. There is nothing called no study design called a correlation study. So here we use it for the two continuous variable, that is age and BP, or income and some example for continuous variable. Age, income and age, income and expenditure, something like that. If you want to calculate, then that is called as correlation thing. We have three correlations. When to use this? When the two continuous variables are normally distributed, use Pearson correlation. Pearson is the p-value, PP, that P is the Pearson. So Pearson has lots of contribution statistics. So Pearson correlation coefficient. Then one variable is not normally distributed, use Spearman's rank correlation test. And if one variable is ordinal variable, use Kendall-Tau. These are all names of choice. Okay, if you understand when two continuous variables are associated, you should use correlation test. In correlation, which test to be used when that can be referred and done. So the basic idea is this. Again, what is partial correlation is to describe the linear relationship. Suppose you want to control for some variable, age and suppose you are studying about age and income, but you want to control for expenditure, then you should use partial correlation. Okay, you are controlling for something, then you should use this partial correlation. I am not going detail into this. So now that is the correlation. Now we are moving into another concept. As of now, we were studying about association. These two groups are two variables significantly associated with each other, are significantly different from each other. Then we use those tests. Now, we are moving one step beyond it, and we are telling how much one variable predicts the other variable. Okay. This situation comes when you will ask the patient to reduce weight for a hypertensive treatment. When you are offering hypertensive treatment, you will offer weight reduction. So weight reduction, he will ask, okay sir, if I reduce 10 milligrams of 10 kilograms, how much how much my blood pressure will decrease? Or same way he will ask. To answer this question, we are using a test called regression test. How much one variable predicts the other variable. I can tell with every 1 kilogram decrease in weight, 1 milligram systolic blood pressure reduction will be there. I will get this finding through regression. Okay, how much one variable predicts the other, that is called as regression. So the comparison of multiple independent factors with one another can be done. So in this regression, I have mentioned only your weight and BP. Suppose if I reduce my weight and with increasing my age, how my BP will be affected? If you want to predict so many factors, regression is the best choice. So many factors at the same time, regression is the best choice. Regression is a workshop conducted by, in regression, CMC will conducts for about 15 days workshop, alone in regression. I think Google has adapted that. So, it is a very, we cannot have it in one slide. I will tell what is the basic behind it. So, we use it to predict one variable with the other variable. Comparison of multiple variables with one variable also we will do. When we say 1 to 1, comparing one variable with other variable, it is called a simple regression. Example, maternal weight affecting birth weight. How much maternal weight predicts the birth weight of the baby? That is called as simple regression. Multiple regression is when you compare maternal height or paternal weight, those stuffs and all, then that will be called as multiple regression. So this is the difference between simple and multiple regression. Linear regression is, linear is line. Linear is line. So whenever your outcome is continuous, that is birth weight, blood pressure and all, it is called as linear regression. Whenever your outcome is categorical, that is this is present or not, then you use logistic regression. So linear regression and logistic regression. When we use many factors to predict one variable, that is called as multivariate regression. So I am giving very basics of regression. So if we do anything in SPSS, we can learn. Okay, so but none of our thesis will, I don't say, sorry, many of our thesis will not have regression analysis in it. Even I have not gone into any analysis for my thesis beyond chi-square test. So chi-square test was a higher level test used by me for my thesis. I will not take the risk. No need to go into high-fi statistics. I will not torture the data to get some results. So I will not do that. So these are all the way of torturing this data. Okay. Now regression is there. So comparison within the group between two repeated values. Nutritional status of the children before and after diet intervention. Parent test is the choice. Parent test is the right answer. Now answer the question for you. Comparison within the group between the two values. Nutritional status of the children before and after diet intervention. Mean is 10, standard deviation is 3.4. I think I have given the wrong values. It is not skewed, but you assume it is skewed. The answer is Wilcoxon-Saint rank test. Now for this group, epi-info group, comparison within the group, categorical data, diarrhea cases before and after disinfecting the pond. Diarrhea cases before and after disinfecting the pond. What is the test of choice? It is a categorical variable before and after. So the test of choice is McNemar's test correctly. Now that group is Zotero. Comparison between more than two repeated values within the same group. Here is the example. Comparison of mean anxiety score between baseline 1 week, 2 week taken from the same group within the intervention. So baseline mean is this. Week 1 mean is this. Week 2 mean is this. What is the test of choice? Yes, fast. Okay, I don't have time. So if the data are normally distributed, then you use repeated meshes ANOVA. Repeated meshes ANOVA. If it is not normally distributed, then you use a test called Friedman's test. Okay, now agreement or kappa statistic. So as of now we have told about before and after intervention, but at the same time I will look for agreement. Now it is very common that people are not agreeing with each other now. So now we need to come, for that also we need a statistics to find out the truth, which is good or bad. So clinician contradicts with microbiologist, pathologist contradicts with surgeon. So we have data like this means for that means we have a test called kappa statistics. It is the same, you remove that before and after, you replace it with clinician and pathologist, then that will become a kappa statistic. Your values will be between significance value, you are not getting p-value 0.5. You will get a value between 0 to 1, which means 0 is completely disagreeing. If I say no, you will say yes. If I say yes, you will say no. That means your value, kappa agreement value will be 0, completely disagreeing. Whenever I say yes, you are also saying yes. Whenever I say no, you are also saying there is no contradiction. Then your kappa statistics will become 1. So this is the kappa statistic for level of agreement. There are, depending on, now the outcome is categorical. So sometimes your continuous variable and all will be there. For that we use this Cronbach's alpha and all. Intra-class correlation is among groups we use that test. Okay. Now one more question. Before concluding my presentation, have you asked why p-value is 0.05? Why it is? We have decided 0.05 is the cutoff value. Beyond which it is significant, just inside is not significant. Have you asked why it is? Nothing to do with the confidence interval. Okay. What is this p-value? P-value is chance of committing alpha error. What is the chance of committing alpha error? As this alpha error is close to 0, I am close to truth. Okay. As this alpha error, as this p-value is close to 1, my alpha error is going to be maximum. I am going to committing alpha error all the time. So the chance of committing alpha error is 0.05, close to 0 is this. We have all come to a conclusion that close to 0 is completely true. So close to 0 will be significant. So this 0.05, we allow 5% error. That is the thing. 1 in 20 times. Okay, it is just an arbitrary value. 0.051 reject. 0.049 accept. That is not there. As it is close to 0, you are close to truth. Remember, in statistics, we never bother about what is truth. We bother about how much we are closer to the truth. So it is just an arbitrary value, like how 17 years, 364-day-old person is not fit for voting. The next day morning, he will get all sort of knowledge to vote. Okay? Is it correct or not? So everywhere arbitrary values are set up like that. Your p-value has also set up arbitrarily as 0.05. As when it is set as 0.01, it is more significant or very significant. So as it is close to 0, you are close to truth. So that is that. My take-home message is these 2 slides, and these 2 slides no need to remember. You can refer any time. You will not be asking any questions or any exams, or nobody is going to ask what is the choice of test for categorical and continuous variable. No ready-made answer. Just refer and tell it correctly. Okay. So that is the thing. These 2 slides will make my presentation. So take-home message is this: don't believe in your memory. Boldly say I don't know. Google is there to help you. You understand the situation, type the situation in Google, statistical test for continuous independent variable and categorical dependent variable, automatically it will display the answer ANOVA. Then why you are here, sir? That is there. Okay, but you should know the circumstance correctly. After looking at the data, you should know the circumstance correctly and ask Google the circumstance correctly. Then Google will tell you with the help of lot of statistical websites. Okay. Clear? So don't worry about the choice of name of test. Worry about the circumstance, type of data, type of distribution, and type of what else? One more thing. Categorical or continuous. So those things. Outcome and predictor variable. These three things are very important. Again, you need not worry about the name of the test and what is the test. You understand these three concepts behind this data, and you check your data. What is this thing? Go and refer, type, ask your friend. Whenever the problem is that we don't accept, we don't know. We always assume that we know everything. That is where we commit mistakes. Accept that we are not confident about certain things. Then we will get the help of right person. Then we will be 100% correct. Okay. Thank you.